RE-MIND is an interesting real-world data study. So it is now clear that we have a number of active therapies in relapsed refractory setting, in the relapsed refractory diffuse large B-cell lymphoma. And it's also clear that we won't be able to compare them all in a randomized studies. It's just impossible. There are just too many permutations. In fact, if you just take the CAR T-cells and available therapies, and you quickly are a number of possible permutations, this would be 120. And how do you sequence them and so forth? So I do believe that in terms of the comparative efficacy and sequencing of therapy, those real-world data studies will be very important. And it is important to remember that they are designed prospectively with the specific parameters in mind. So just in RE-MIND, for example, the patients were matched to the study population of patients treated with tafasitamab and lenalidomide, and predefined covariates were used to make sure that this match of the population is as close as possible to the study population. Which results in sometimes very large patient denominator. In case of the RE-MIND, it's over 3,000 patients, which then it limits the comparison only to the patients who are very closely matching for all the prognostic factors and covariates which were predefined in this study. In case of the RE-MIND, the ongoing question was how combination of tafasitamab and lenalidomide compares with other frequently used therapies in this setting as a pool of all therapies in the relapsed refractory setting, but also as specific therapies like bendamustine, Rituxan, lenalidomide, Rituxan, or CAR T-cells. And the endpoint in this study was an overall survival because it's a quite objective endpoint. And what the study has shown that tafasitamab and lenalidomide combination compared very favorably with other treatments used in this space, including bendamustine, Rituxan, lenalidomide with rituximab. And also what was very interesting with CAR T-cells, so the number of patients is very small. For the matching population, the signal of activity appeared to be quite comparable to CAR T-cells, which is very exciting for the antibody-IMiD combination.